we are. This hearing on the Committee on Agriculture, Subcommittee on Nutrition to review SNAP characteristics and dynamics will come to order. Good afternoon and welcome to this year's first meeting of the Nutrition Subcommittee. Appreciate all of you being here. Appreciate our other members coming as they finish voting. Today I would like to give you a glimpse of what lies ahead for this subcommittee over the next 2 years as we review SNAP. Before we begin, I want to just take a quick opportunity for everyone here to understand my background and why this issue and this subcommittee is important to me personally. First and foremost, I'm a lifelong Hoosier. I've dedicated my career to helping Hoosier families. After I married my husband, we made the decision to move to Romania in Eastern Europe, where we created and ran a local foundation, spent 4 years providing resources to impoverished children across that country. I know what poverty looks like, both internationally, and I know what it looks like in my own district, in Indiana 2nd District, and how it affects families and communities. And when I read that 1 in 6 Americans are hungry, it reaffirmed my commitment to ensure that no child or adult endures what I've seen others go through. In order for us to be successful, it's imperative that we first review the SNAP program to better understand what works and what doesn't work. The full committee yesterday examined why a review of SNAP is important. It's the largest feeding program in both the number of recipients and the amount of spending. Yet the program lacks a clear mission, and the data seems to show us that it doesn't necessarily support families coming out of poverty. And it's not necessarily helping lift people into better circumstances. It's my hope and expectation that this subcommittee, along with the work done at the full committee, will explore and gain a better understanding of the entire program, specifically its recipients, to find unmet needs and areas of overlap. The SNAP program does not function by itself, and many other factors contribute to its ultimate success. That's why it's so important that this subcommittee focus our efforts on understanding how SNAP can best serve families and children across the United States. What is clear to me, and what I hope becomes clear to you in the coming months, are the many layers of bureaucracy that does exist inside of SNAP. Currently, 18 different programs provide food assistance, and while many of them do not fall within this committee's jurisdiction, they do serve SNAP recipients. In addition, a range of low-income benefit programs are offered at the local, state, and federal levels. On top of that, a web of nonprofits and community service providers do exist to provide assistance. While I recognize the government's role in this process, there are incredible local organizations in my district, like St. Margaret's House and the Food Bank of Northern Indiana, that help to feed Hoosiers in my district and provide support to families and children in need. This is why understanding the overlap and unfamiliarity of local programs will help us decide how to best provide support services to families in need. In the coming months, we'll be able to tackle these issues and more, but today is about understanding those families in need, who they are, what's brought them to the program, how long have they remained in the program, so we better understand how to serve them. Today is not about policy recommendations. It's about understanding the diverse characteristics and dynamics of the more than 46 million Americans who receive benefits from this program each month. Over the coming months, our review will include a range of stakeholder perspectives, including current and former recipients, not-for-profits, states, localities, the food industry, and nutrition experts, to name a few. Today we'll hear from a panel of distinguished researchers who have all conducted well-documented studies using trusted government data sources. In most cases, the research has been funded by the Department of Agriculture's Food and Nutrition Service, which oversees the administration of SNAP. I want all the members to know that I am always available if you want to offer any input as we move forward with this process. I thank all of our witnesses for being here with us today. I look forward to their testimony. I would now like to recognize Ranking Member McGovern for his opening statement.
Thank you very much, Chairman Walorski, and congratulations on chairing your first hearing of this subcommittee. I want to start by thanking you in particular for reaching out to me beforehand and setting up a time for us to get together, to know each other, and to chat. I really appreciated the gesture, and I look forward to working with you on hunger and nutrition issues. You know, all too often around here, members talk at each other rather than with each other, and I'm glad to say that we are off to a much more productive start. I also want to thank the witnesses for being here today with us. As I said at yesterday's hearing, I'm a little surprised that we're starting the first top-to-bottom review of programs within the committee's jurisdiction with SNAP, a program whose caseloads and spending are going down according to CBO. I hope we exercise the same rigorous oversight on farm subsidies to big agribusiness. Payments that CBO projections indicate could end up costing us nearly $5 billion more than expected in the Farm Bill. I want to ask my colleagues to remember just how poor you must be to qualify for SNAP. Approximately 92% of SNAP's benefits go to households with monthly incomes below the poverty line, and 57% go to households with incomes below half the poverty line. For a family of three, the poverty line is about $1,650 per month. That's not a lot of money. SNAP eligibility requirements are tough, even if you are poor, and the program has one of the lowest error rates of any federal program. The bottom line is that SNAP works. I hope today's hearing builds upon some of the overreaching themes that came up yesterday. In particular, we need to address one of the biggest flaws in our social safety net, the so-called cliff. This happens when someone gets a job but earns so little that they lose their benefits and end up worse off. And if we really want to move people out of poverty for good, I think we ought to begin by raising the federal minimum wage. Many of these issues are outside the purview of this committee, which is why I'm asking the White House to hold a White House conference on food, nutrition, and hunger. We should bring people together from different federal agencies, businesses, nonprofits, faith-based organizations, beneficiaries, and so on, to come up with a holistic plan to end hunger, a roadmap that we can follow with real benchmarks. I look forward to hearing from the witnesses, and I thank the chairwoman for holding this hearing.
Thank you, Mr. McGovern. The chair would now like to recognize Chairman Conaway for his opening statement.
Well, thank you, Madam Chairman. I appreciate that. I don't have a lot to say other than to quote that wise sage, Pete Session. He said, always make a big deal of making the big deal the big deal. And nutrition, this review, and the efforts that we're going to put in on getting these policies correct is the big deal. You can look at the makeup of the committee with the vice chairman and the other subcommittee chairman that are on this committee, and to me this is the big deal, and I've got the right person in the chair to lead this effort, and look forward to her work. We did have some interesting comments yesterday. The idea that this program is morphed over time into an income support program more than it is a calorie provision program, and the other side benefits, side issues that America faces with child obesity and adult obesity and other things. Looking forward to seeing how we can find the right policies to address the issues that are under our jurisdiction. And I've got great confidence in this subcommittee's work and look forward to seeing that happen, and I yield back.
Thank you, Chairman Conaway. The chair will request that other members submit their opening statements for the record so the witness may begin their testimony to ensure there's ample time for questions. The chair would like to notify members that they will be recognized for questioning in order of seniority for members who were here at the start of the hearing. After that, members will be recognized in order of arrival. I appreciate members' understanding. Witnesses are reminded to limit their oral statements to 5 minutes. All the written statements will be included in the record. And with that, I'd like to welcome the witnesses to our table today, to our hearing table. Ms. Karen Cunningham, Senior Researcher, Mathematical Policy Research. Mr. Gregory Mills, Senior Fellow, Urban Institute. Mr. James Ziliak, Founding Director, Center for Poverty Research, University of Kentucky. Mr. Stephen Tordella, President, Decision Demographics. Ms. Cunningham, please begin when you are ready.
Thank you, Chairwoman Walorski, Ranking Member McGovern, and members of the subcommittee for the opportunity to testify today. As you know, SNAP is a central component of the nation's nutrition safety net. In fiscal year 2014, it provided benefits to 46.5 million people in an average month, slightly down from fiscal year 2013. Today, I will describe a set of resources you can use to gain a deeper understanding of the SNAP population. These include Mathematica's new SNAP data visualization, reports we produce for FNS on the characteristics of SNAP households, and the data and computer models used by FNS to examine proposed changes to SNAP. I will use these tools to highlight information about SNAP and the characteristics of the SNAP population. The SNAP data visualization tool presents complex data in an easy-to-understand interactive format. Could we have the visual on that? Thank you. Are we good?
Hang on 1 second. This is like a technical timeout.
And if you have binoculars, I might need them.
I've got bifocals. Let's just go off the record.
I think it's ready now.
You good? We good?
Yes.
Okay. Go ahead.
Thank you. The SNAP data visualization tool presents complex data in an easy-to-understand interactive format. In the SNAP overview module, we can compare SNAP participation since 1969 with participation in other government programs like the school lunch program, WIC, and unemployment compensation. We can also compare expenditures on SNAP with expenditures for the other programs. In the SNAP participation module, we can compare poverty, SNAP eligibility, and SNAP participation across states. Here we see a comparison of states by the percentage of people with income under 200% of poverty. We can contrast that with state estimates of the percentage of people who are eligible for SNAP. Clicking on a particular state provides an easy way to compare poverty, eligibility, and participation within the state. I encourage you to explore this tool and hope you find it helpful in your examination of SNAP. Another important resource is FNS's series of annual reports on the characteristics of SNAP households, the latest of which is for fiscal year 2013. The reports include a wealth of information about SNAP and SNAP participants at both the national and state levels. For instance, the report provides detailed information about SNAP eligibility rules. This includes income and asset standards, allowable deductions, and non-financial eligibility restrictions. The report also describes how states have some leeway to establish their own income and asset eligibility criteria. For example, many states use a TANF-funded non-cash benefit to confer categorical eligibility on a large number of low-income households. States who do this have established income limits and, in some cases, asset limits for households to receive the TANF-funded benefit. Benefits for these households are determined using household income and the same rules that apply to other eligible households. In addition to describing eligibility criteria, the report contains data on the varied characteristics of SNAP participants. For instance, readers can see how average monthly SNAP benefits vary by household composition. This is also graphically shown on page 5 of my written testimony. In fiscal year 2013, the average benefit for households with an elderly person was $134, compared to an average $410 for households with a child. The report on SNAP household characteristics also illustrates how SNAP targets benefits to the neediest households. As shown on page 7 of my testimony, 43% of SNAP households had monthly incomes at or below 50% of the poverty guideline. These households receive 57% of all SNAP benefits. In contrast, 5% of SNAP households had monthly income over 130% of the poverty guideline. They received only 1% of SNAP benefits. The report further shows that 75% of SNAP households included a child, an elderly person, or a person with a disability. These households received 82% of SNAP benefits. The numerous appendix tables show how the characteristics of SNAP households vary across states. For example, state percentages of SNAP households with monthly incomes at or below 50% of the poverty guidelines range from a low of 24% in Vermont to a high of 67% in California. This is just a small sample of the information available from the report, which I hope you'll find a valuable resource. Even more information can be gleaned from the SNAP QC data upon which the report is based. This edited database is publicly available via the Department of Agriculture's website. The data also form the basis for one of the sophisticated SNAP microsimulation models FNS and Mathematica have worked together to develop. These models are designed to simulate the effect of proposed policy changes on household eligibility and predicted participation and on SNAP benefit costs. These tools and the data they present can contribute to an understanding of how SNAP has been operating and can provide a foundation for discussion and consideration of potential changes to the program. Thank you.
Thank you, Ms. Cunningham. Mr. Mills, please proceed with your testimony.
Good afternoon, Madam Chair and members of the subcommittee. My name is Greg Mills, and I am a senior fellow at the Urban Institute, a nonprofit research organization focused on social and economic policy. I thank you for this opportunity to describe our recent study on participant churning in SNAP. We conducted this research for the Food and Nutrition Service. Any views I express are my own as project director and should not be attributed to the Urban Institute, its trustees, or its funders. Churn occurs when a household receiving SNAP exits the program and then re-enters within 4 months or less, as defined by FNS for this research. Some churn is expected, as when a family briefly becomes ineligible through a temporary increase in earnings. Churn is a serious concern, however, when the cutoff in benefits occurs for households that remain eligible, and especially for households with children or elderly or disabled members, which includes about 2/3 of churners. I will first highlight our major findings and then turn to policy implications. The 6 states that participated in this study, Florida, Idaho, Illinois, Maryland, Texas, and Virginia, all provided detailed program data. The rates of SNAP churn for these states in fiscal year 2011 range from 17 to 28%. These estimates indicate the percentage of households receiving SNAP benefits at any time during that year who experienced at least one churn spell, that is, a break in participation of 4 months or less. The causes of churn are complex. Fluctuations in the earnings of SNAP recipients appear to play only a limited role. In these scenarios of exit and re-entry related to job gains and losses, the program is functioning as it should. The much larger story, however, relates to the process. Recipients experience difficulties with required procedures at periodic recertifications of their eligibility or when they are to submit an interim report on household changes. Based on our focus groups with churners, the difficulties appear to stem from 3 types of factors. First, changes in household circumstances, such as a move, a car breakdown, or some other disruption that caused a recipient to miss a deadline. Second, challenging personal characteristics relating to physical or mental health, literacy, or language proficiency. Third, a lack of clarity in agency notices sent to clients or the failure of those notices to reach the client. Churn has financial consequences for both agencies and households. Agencies incur additional administrative costs to the extent that the case requires a new application, involving 2 to 3 times as much caseworker effort as a recertification. Households lose benefits to the extent that they remained eligible during their churn spell. The foregone benefits, although a small percentage of a state's annual benefit payments, can cause significant hardship for the affected clients. The added agency costs, about 2% of annual administrative costs in the program, represent potential budgetary savings. So, what are some of the key underlying patterns of churn in the states we studied? 2/3 or more of churners are off the program for 1 month or less. For a similarly high proportion of churning households, the exit occurs at a scheduled recertification or interim report. About half of all households that churn appear eligible for SNAP while off the program and thus experienced a loss of benefits. Churners are much more likely than other recipients to have moved within state to a new zip code. Households with elderly or disabled members are more likely than others to churn when one focuses specifically on households coming due for recertification. In closing, I'll now turn to some policy implications. Our evidence suggests that SNAP churn has adverse consequences to both agencies and households that are sufficient to warrant policy action. A lower rate of churn is clearly a desirable goal. It represents an improvement in benefit access and service quality for recipients. Any program changes, however, will need to balance improved benefit access with maintaining program integrity and containing budgetary cost. In each of the 6 states, we asked local SNAP administrators and caseworkers to indicate what aspects of the program can reduce churn based on their experience. Here are 4 of their ideas. First, align a household's recertification dates for SNAP, TANF, and Medicaid. Second, eliminate the requirement for a face-to-face interview at recertification. Third, use agency call centers to handle routine client communications. And fourth, for clients unable to provide requested documentation, allow a 30-day grace period during which their benefits could be renewed without a complete reapplication. These are relatively straightforward procedural improvements that many states have implemented and that others could be encouraged to adopt. Unlike more basic changes in program eligibility rules, these actions would not require difficult trade-offs between access, integrity, and cost. This study provides the systematic evidence needed to consider such steps. Thank you very much.
Thank you, Mr. Mills. Mr. Ziliak, please proceed with your testimony.
Madam Chairwoman, Ranking Member McGovern, and members of the subcommittee, thank you for the opportunity to appear before you today. My name is James Ziliak. I hold the Carol Martin Gatton Endowed Chair of Microeconomics at the University of Kentucky, where I'm also founding director of the Center for Poverty Research. For the past 2 decades, I've conducted and published peer-reviewed research on the U.S. safety net, including SNAP and its predecessor, the food stamp program. My testimony today draws from my research on changes in SNAP participation that can be found in the forthcoming book I'm co-editing at Stanford University Press entitled SNAP Matters: How Food Stamps Affect Health and Well-Being. SNAP has become a central component of the social safety net in the U.S. Today, 1 in 7 Americans receive assistance from SNAP at a cost of $75 billion, making it the second largest means-tested transfer program in terms of cost after Medicaid. From fiscal year 2000 to FY 2012, the number of participants increased 171% and inflation-adjusted spending by 286%. What accounts for this growth? As I demonstrated in my research, the weak U.S. economy, reflected by higher unemployment, lower incomes, and higher income inequality, was the main reason the number of Americans on SNAP grew since 2000. That SNAP is highly responsive to changes in the macroeconomy shows that it functions effectively and efficiently as a key anti-recessionary policy tool. That is, as incomes fall during a recession, participation in SNAP rises to bolster food consumption for children and adults. This past decade of near uninterrupted growth and participation is unprecedented in the program's history. By most measures, the recession of 2001 was mild, and past experience would have dictated a decline in participation in the mid-2000s. This did not happen. The increase in SNAP in the middle of the decade stemmed in part from stagnant household incomes and a continued widening of the distribution of income, making it increasingly difficult for low-income workers to make ends meet. Participation then accelerated with the onset of the Great Recession as millions of Americans lost work. But another important factor that led to the growth in participation since 2000 was changes in federal and state SNAP policy that improved program access and delivery to needy Americans. In the aftermath of the 1996 welfare reform and concurrent expansions of the Earned Income Tax Credit, scores of former welfare recipients entered the labor force. And even though many remained eligible for food stamps, they left that program as well, potentially exposing them and their children to heightened food insecurity. The policy reforms, including the 2002 Farm Bill, were designed to counteract the declining participation among eligibles, in part to foster the transition from welfare to work for former AFDC recipients. The reforms conferred greater flexibility to states to improve program take-up and administration, and they worked. During the same period, there were countervailing demographic forces on the SNAP caseload. America is aging, and given that seniors are much less likely to participate in SNAP, this puts downward pressure on growth. Moreover, in recent decades, increasing numbers of Americans matriculated from high school and college, and since higher education leads to higher incomes, a more educated population also leads to lower SNAP use. On the other hand, more children are raised in single or multi-generational households who tend to be more poor and more likely to need assistance. Additionally, there's been a rise in disability, which also puts upward pressure on SNAP. Combined, however, my research shows that the changing demographics of the American household have actually helped to keep the growth of SNAP in check. At the same time, these changing demographic forces have led to a changing composition of the SNAP households. While the majority of recipients continue to be children, seniors, and the disabled, that is, those persons not expected to work, SNAP has increasingly evolved into a work support for households whose head works full year, has at least some college, and lives in a household with annual incomes in near poverty. In conclusion, SNAP is operating to combat hunger and poverty during periods of economic hardship as Congress intended. It's the second most effective anti-poverty program in our safety net for the non-elderly behind the EITC, and is more effective than the EITC at lifting families out of deep poverty. Even though the program's at record highs in terms of participation and costs, it's also functioning more efficiently than ever with record low error rates and benefit determination, having fallen by over 45% in the last decade alone. SNAP matters more today in the safety net. Thank you very much.
Thank you, Mr. Ziliak. Mr. Tordella, please proceed.
Thank you, Chairwoman Walorski, Ranking Member McGovern, and committee members. Today I'll talk to you about flows onto and off of SNAP, tracking who goes on to SNAP and at what rates, what events are associated with entering or exiting the program. Once on the program, how long do participants stay? When people leave the program, do they come back? Also, I'll compare recent results with our studies from the early and mid-2000s. We used the Survey of Income and Program Participation, or SIP, to follow 25,000 U.S. households from mid-2008 through the end of 2012, with data on every person every month. We focus on people who might be at risk of joining SNAP, those below 3 times poverty. Our study includes the peak of the recession and continues for 3 years afterwards. SNAP participation grew from 29 to 48 million people during the study period. So let's start at the beginning with entry rates. During our study period, 0.7% of lower income people joined SNAP each month. In the early 2000s, the entry rate was 0.4% monthly. So the entry rate almost doubled in about 10 years. SNAP entry patterns differ by family situation and income. People who had received SNAP before were 3 times more likely than average to enter SNAP. Entry rates were also higher than average for families with children or disabled members and those without income. Elderly adults and ABODs, the non-disabled 18 to 49-year-olds without dependents, had lower than average SNAP entry rates. So what events are associated with entering SNAP? The most common events were decreases in family earnings, unemployment, and family changes. 30% of SNAP entrants had a recent decrease in earnings. 15% were in families where someone became unemployed, and over 10% had a family change like pregnancy, a new child, or divorce. So once on SNAP, how long do people stay? We call people's time on SNAP a spell. At any given point, there are both short and long spells in progress. So let's look at shorter spells in our sample by measuring the length of every new spell that started during 2008 to 12. The average new spell length was 12 months. That is, half of participants had left SNAP within 12 months. This compares to 8 months just after 2000 and 10 months at mid-decade. People in single-parent families, below poverty, and disabled adults had longer spell lengths. Elderly living alone had the longest spells of any group, an average of over 4 years. ABODs had the shortest spells, along with those whose income was more than twice poverty. In all, 2/3 of new spells were over within 2 years. But what about the people who were already receiving SNAP when the study period started? Many of them were in the middle of longer-term spells. Think of older people on fixed incomes whose living situations may stay the same for years at a time. If they qualify for SNAP, they could need the program for a while. So to study these longer spells, we took everyone on the program as of December 2008, looked back to when they started the program and forward month by month for another 4 years. These continuing spells on SNAP averaged 8 years. During the mid-2000s, it was 7 years. Older population groups again had the longest spells, over 8 years, while for ABODs, the average was only 3 years. Next, let's consider the events associated with exiting SNAP. Just like entry, earnings and family situations are the main exit events. People who start to earn more money are likely to leave SNAP. Also, 1 in 5 people who had a family member exit the household exited SNAP within 4 months. Finally, when people leave SNAP, do they come back? Well, in 2008 to 12, nearly half of those who left the program re-entered within a year. That was faster than during the mid-2000s. Some groups re-entered more quickly, including children and those below poverty. Other groups took more time, including elderly and families without children. In sum, our study of SNAP dynamics showed that the program responded to changes in the economy during the recession and its aftermath in the expected ways. Entry rates were higher than before, spell durations were longer, re-entry was faster. These factors combined to cause program growth, but SNAP participation was still driven by individual circumstances. Entry rates and spell lengths were highest among the poor and decreased with income. Changes in employment and earnings were the most common entry as well as exit events. These findings underscore that the program is responding to changing economic conditions as well as individuals' changing needs. Thank you.
Thank you, Mr. Tordella, and thank you to all of you for your testimony. We're going to move into the question period now. Mr. Mills, I have a question for you. In your churn study, talking about the cycling families on and off of benefits, you mentioned one of the reasons that recipients were experiencing personal difficulties, and kind of in a follow-up to a question I had yesterday on the full committee on SNAP about families getting real help. What's the engagement level of states going into these recertifications?
It's rather extensive. That is to say, the effort that is put into the recertification is a full review of the eligibility factors of the case. So it's immigration, citizenship, it's their household income, expenses, and resources. So it is, in terms of caseworker effort, it's probably something like 2 to 3 hours of a caseworker's time.
So there is a caseworker from SNAP that potentially knows there's a situation with a family?
A scheduled, well, I'm talking actually about a scheduled
Okay.
recertification.
Yep.
So those would occur typically at intervals of 12 or 24 months. The point I was trying to make in my testimony was that the, say, 2 to 3 hours that might be spent by a caseworker at recertification is far less than what is required at an initial application. And the phenomenon of churn causes individuals, once they go off the program, many of them have to come back by going through a full initial application, which may require, say, 6 or 7 hours of a caseworker's time. So it's
And what did you learn in your interview process on interviews with SNAP staff and those in the community-based organizations?
I indicated some of the recommendations that individuals have, the staff of these offices. We interviewed staff in one local office in each of the 6 states. We also interviewed representatives of community-based organizations. And I believe that the chairman actually made reference in his opening statement the other day to the kind of extension of the food assistance network to include food banks and other nonprofit organizations. Some states do make use of such community-based organizations to assist clients in the outreach and in applying for benefits. That is a strategy that some states also use at recertification, allowing the client to be interviewed by a worker at a food bank if, for instance, they might find it difficult to get to a local office, and if they're already going to that food bank, and it would represent less burden for them.
I appreciate it. Maybe this is the disadvantage of longer certification periods, fewer interactions and opportunities to help families. I appreciate your testimony.
Yes.
I now recognize Mr. McGovern for 5 minutes.
Thank you very much. Just on this issue of churning and recertification, we had a witness here yesterday who said that there should be more certification processes. And I guess my question to you is, how would requirements for more frequent recertification likely affect the churn rate?
I think of this as a trade-off that's a difficult one to make. As I pointed out in my testimony, there are multiple objectives here. You want to provide access to the program for those who are eligible for benefits, and at the same time you want to maintain the integrity of the program by not allowing those who are ineligible to access the program. So the procedural barriers exist for multiple reasons. You want to make sure that people, in fact, meet the eligibility requirements, but you don't want to place those barriers, those hurdles so high that it might prevent those who are, in fact, entitled to receive benefits from entering the program. In general, as I think you've heard from Mr. Greenstein the other day, the error rates in the program are very low. Only about 1% of recipients in the SNAP program are, in fact, ineligible and should not be receiving benefits. All others are eligible and perhaps not receiving the correct amount. But the program, by those measures, is very well administered, reflecting the amount of attention that goes into initial certification and recertification. More barriers, I think if this is getting to your question, more barriers, more procedural requirements almost certainly would increase the rate of churn, because there would be some individuals eligible for assistance who would not be able to meet those requirements. They would go off, but they'd be unable to make ends meet without those benefits. They would reapply.
Right, and I'd like to think that we all can agree that everybody who is eligible for this benefit should be able to get it, that we shouldn't be going out of our way to make it more difficult for eligible people to be able to get a food benefit. Mr. Tordella, I'm concerned about the different ways of looking at the length of SNAP spells that you cite, and that some people get the mistaken impression that too many people receive SNAP for too long. Doesn't the program have an extremely low share of ineligible people participating? So if people receive benefits, aren't we pretty sure that they need help feeding themselves and their families?
Sorry. None of our data actually reflect directly on whether the people are ineligible, and we didn't choose to, so we didn't try to judge that or infer that. The difference is in order to, though, get a complete picture of what's happening on SNAP, you have to look at both the short-term spells, that is spells that have just started during the period that we observed, and be able to look at the longer-term spells as well, because those may be in progress when you start the study and they still can be going on afterwards. But with regard to the short-term spells, and they're two-thirds are over within 2 years.
Right. Well, let me just ask anybody in the panel, because this is a question that constantly gets raised, that somehow that we have lots and lots and lots of ineligible people taking advantage of the system who are on this or enrolled in this program. Does anybody want to dispute that? Mrs. Ziliak?
Yeah, there's no evidence to back up that claim. I mean, it is a very efficiently run program. The overall error rate today is around 3.2%. That's the benefit determination error rate. The number of individuals on the program who are ineligible is a very small fraction of the total caseload. These long spells that you pick up in the data are frequently people who are elderly or disabled, individuals who aren't in any physical capacity to exit the work and improve their economic situation. So they're just, these long spells it's a different population than the typical spell that we see on the caseload, which is a more dynamic population.
Anyone have a different opinion? Mr. Mills?
If I could just expand on that response. The error rates in the program are now at all-time lows. If you look at the trend, it's dramatically down over the last 10 years. Some of the errors that actually occur and are detected through the quality control system are errors of underpayment. There are some individuals who actually are not receiving fully the benefit they're entitled to. Moreover, there are quality control reviews that reflect or indicate improper denials and terminations in the program, the phenomenon I'm mentioning about excessive procedural requirements. The other thing I'll note is that other measures of integrity, such as trafficking of SNAP benefits, also show very low rates. Retailer trafficking is only about 1.3% by the most recent estimates of total benefits redeemed.
Sounds like a good, well-run program. Thank you.
I now recognize Mr. Davis for 5 minutes.
Thank you, Madam Chairman, and congratulations on chairing this subcommittee. Proud to be a part of it and proud to have you here on the House Ag Committee. Yes, and Mr. Ranking Member, it's always great to spar with you, not only at the committee level, but also at the subcommittee level. And congratulations to you too, sir. But more congratulations to Jackie. That's just part of being in the majority. I apologize.
I can't give you any more time. Your time's ticking.
Oh, that's okay. I hopefully won't talk the entire time. I actually want to hear some information out of the panel. Thank you for being here. Hopefully what you've seen in the last 30 seconds is we actually do like to have fun up here. I'm a big supporter of children who are hungry, getting access to the food and nutrition that they need through the SNAP program or other programs. And I know that in opening testimony, Ms. Cunningham, that you had mentioned some of the other programs that feed children and those who are in need of hunger assistance besides SNAP. And this goes to the whole panel. Is there any way, can you elaborate on some of the other programs that are available? Like I know I visited some summer lunch sites during the summertime to feed kids who were part of the school nutrition program. And just one observation on the program that you decide to talk about that you think we can do as a Congress to make them more effective and work better. So we'll start with you, ma'am.
Sure. Well, there's the National School Lunch Program. There's also in schools, there's the School Breakfast Program, which is expanding in recent years. It serves breakfast to hungry children. There's this summer feeding program that you discussed. In terms of recommendations, I know that there's a wealth of research out on those programs, and I can provide you some of those resources. I don't have recommendations myself, but I do hope that you'll look at the information that's out there.
I'll be glad to get the information, but if you have recommendations, and that's what we're here for too, is to, you're the experts, and I know for my purposes, I want to know what you think's going to make us be able to put better policy in to achieve the goals that we all have. Mr. Mills?
Yes, I know this is the Nutrition Subcommittee after all, and one of my interests and reflecting on other research I have done is what could be done to enable these programs, the ones that have been mentioned, to promote better informed and more healthful choices on what individuals and families with children in particular consume. I think there have been efforts not only in the SNAP program and in other programs, including WIC and school lunch and school breakfast, to encourage more consumption of fresh fruits and vegetables. You may be familiar with an experiment that's now ongoing in Massachusetts and largely completed called the Healthy Incentives Pilot in SNAP. I know you've been asking about other programs, but that's a means of, through price discounting of healthier foods, encouraging families to purchase those items and not others. So I think my own feeling, and based on my own research, is that the programs should try to strike a better balance between improving the the income capacity and income supplementation, but at the same time improving nutritional intake.
All right, well, thank you for I'm reclaiming my time real quick. Thank you for your comments on the school nutrition program. I agree kids need to eat healthier, but we also have to provide the flexibility that there's not a top-down approach that we sometimes see that forces school districts out of the school nutrition program. So I'd love to work with you on that issue, too. Mr. Ziliak.
Yes, thank you. So with the school feeding programs, it turns out that the SNAP program is oftentimes a gateway for children onto the school breakfast or lunch program through the eligibility standards used for the school feeding programs. But it also works the other way around, that some of the school breakfast and lunch programs, children enter on the SNAP after they go on to the school programs. And so there's a real important coordination between the overall SNAP program with the school feeding programs that assist children. Dr. Mills also mentioned the WIC program, which of course is a very important nutrition assistance program for low-income families. It also works in conjunction with the SNAP program. So I think with children, what we're able to capture is kind of this more wraparound food provision. There is a demographic of children who don't receive as much assistance in the school feeding programs, and that's teenagers. Okay, the kids in high school, and so that's still a group that kind of falls through the crack through some of these programs.
Thank you. I think I'm out of time, Mr. Tordello. Thank you.
Chair recognizes Ms. Adams for 5 minutes.
Thank you, Madam Chair, and thank you to all who've testified today. I appreciate you being here, and I appreciate the hearings on the on SNAP that are driven by data and research. I'm an educator by training, so I certainly appreciate that. And I hope that we're able to use the oversight hearings as an opportunity to learn how the program works, and before we pass judgment on the people who receive the benefits. Dr. Mills, your testimony included the recommendation for states to align the recertification dates for SNAP, TANF, and Medicaid. How many states in the Southeast have implemented your recommendation?
There are about 40 states nationwide, and I can provide for you information for the record as to who those states are that do integrate the application process between SNAP and Medicaid. And some of those also extend that integration to other programs, including TANF. I think the recommendation that I have is to ensure that that integration extends also to the recertification process, and that, for instance, the recertification dates that clients face be aligned so that they don't, within, let's say, a year-long period, face multiple deadlines. For many recipients, that's confusing. And it's what leads in part to these procedural difficulties. So, but I certainly can provide to you information, especially about states in the South.
Yes, I would appreciate that.
Yes.
If you could tell me, in terms of the churn program, how many children are exposed to that program within the SNAP program, And how does it impact their access to free school meals through direct certification?
Well, churning is the kind of the movement of cases receiving SNAP off the program and then back on within a period of 4 months. So it's the some of what you've heard from the witnesses here is about length of time on the program. This really is more about brief periods off the program, but we're talking about SNAP receipt, SNAP benefits. Now, children, of course, are an important part of this program in general, and so not surprisingly, a very substantial percentage of those who churn are families with children, approximately half. And if you include also elderly and disabled households with elderly or disabled members, it's approaching 2/3 of churners that have, I guess, what you would call vulnerable individuals within the household, individuals whose food security then is almost certainly adversely affected by the disruption of benefits.
Dr. Zalik, besides the work requirement for able-bodied adults with children, how have other major policy changes, such as the expansion of the Earned Income Tax Credit, contributed to most SNAP recipients working while receiving benefits?
So it turns out that the number one program that SNAP recipients receive after SNAP is the Earned Income Tax Credit. And the program after that is the Child Tax Credit. And this comes from the same data set that Dr. Tordella was using for his analysis. And so the program combines with SNAP, right? The Earned Income Tax Credit is a work supplement, and for these households, SNAP is functioning akin to the EITC and providing some assistance to the family who are working in low-wage occupations. So in terms of other policies besides the EITC, the SNAP policy at the state level that have been implemented, for example, a number of states receive waivers to increase their vehicle asset limits, which facilitates the transition from welfare to work. There was increases in simplified reporting, so that it made some of the recertification processes a little bit easier. Dr. Mill was talking about some of the challenges with recertification, but in the absence of the simplified reporting, undoubtedly the churn would have been a lot worse over the last decade. So things like expanded asset limits, expanded vehicle limits, simplified reporting, have all facilitated families' access to the program over the last decade.
Thank you, Madam Chair. I yield back.
The chair recognizes Mr. Abraham for 5 minutes.
Good evening. Ms. Cunningham, I'll reference your map. You don't have to put it back up there, but certainly any of you gentlemen and ladies can answer the question that you want to. Just looking at the map, it looked like there were probably some demographic differences between rural and urban places. And if that is indeed the case, what is the SNAP doing to address them on the federal level, and what are the states doing to tailor their programs more to meet the differences in the needs and the demographics between a rural and an urban population?
That's a great question. States do have more flexibility now to tailor the program in their state to meet their population's needs. They do this through the expanded categorical eligibility rules. They can set income limits, and if they want an asset limit for a household to receive a TANF-funded non-cash benefit and become categorically eligible for SNAP. They still need to qualify for a benefit, and that benefit depends on their income. But if a state thinks that they ought to have a higher asset limit or no asset limit, or if a state wants to set the gross income limit for households with children slightly higher, or for households that only have elderly or disabled people, they're able to do that now through this categorical eligibility program. I'm not aware of states specifically changing a program for rural versus urban, but they can definitely meet the needs of their population through.
And I'll just follow up. Mr. Tordella, on your study of 25,000 people, what are the demographics of the study? Was it urban? Was it rural? Was it one particular state? Was it several states across the nation? Where did your population of data come from?
The study of 25,000 people is the Census Bureau's survey of income and program participation, and it's designed specifically to measure trends in social programs like TANF or SNAP.
I understand that, but do we know the demographics of the data? Was it mostly urban or mostly rural or a combination?
It was a nationally representative sample, and it started off with 52,000 households in 2008, and 25,000 households made it out the other end after having answered the questions every 3 months or every 4 months about all the people in their households. So they stuck it out with us.
Okay.
But in order to compensate for those losses, if we had disproportionate losses in urban or rural places, we weighted the data to compensate.
Okay. And this is mainly just for the whole panel. Whoever wants to join in can answer the question. It's my understanding that in the Farm Bill there is a pilot program for employment and training that is available. And I guess the question is, other federal agencies also have these same types of programs. Just your opinion as to how will that well work in the SNAP program as far as trying to get some of these folks a good job?
I can just respond briefly. About of the households we were looking at, and I'm trying to tie your question to this phenomenon of churn, about 40% of the households that churn are households with earnings, and even higher in some of these states. I think your question is really to the point of how can we increase the percentage of households receiving SNAP who have earnings. The evidence, and others can speak to this, is mixed on the effect of such policy changes. I think principally it's the strength of the economy that increases the prospects for employment that would enable households to mix benefits along with earnings.
I guess my question, looking in your crystal ball, do you think a program such as this would be beneficial?
The issue is whether or not it's funded at the appropriate level to provide the adequate level of training for states to do it in an effective way in conjunction with the SNAP program. I think that the view of SNAP as a safety net, a food assistance program, and not a training program is really kind of, the crux of the matter. And the issue is, historically there hasn't been, the level of funding provided to the states to support the training initiative. These new pilot programs, I think, will certainly shed some light on the different types of training opportunities available to this population.
I'm out of time, Madam Chairman.
Chair recognizes Mr. Aguilar for 5 minutes.
Thank you and congratulations, Madam Chair and Ranking Member. I look forward to these discussions. Mr. Mills, if you could just continue to expand on that. I was interested to note the higher rate of churn among the employed, which was kind of where you were going, I think. To what do you attribute that to?
Well, in part, it's this natural phenomenon of individuals whose attachment to the labor force is a bit episodic, and we all know this. In the low-income population, individuals with lower skill levels often hold jobs for short periods of time. They may take a job but then lose it soon thereafter. So it's really a proper functioning of the program in these situations. Then when someone takes a job, they go off the program because they are ineligible, but then they lose that job, or maybe something else happens, maybe just hours are reduced, they are once again eligible and they reapply, come back on. However, in addition to that is the fact that there are more procedural requirements for individuals with earnings to the extent that they have to provide verification of the amount of their income and deductible expenses to determine their net income on the program. So those requirements, whether it be forms or pay stubs or other forms of documentation, are additional hurdles that one has to meet to stay on as an earner. So the objective should be, I think, to try to encourage employment, enable individuals to combine benefits from the program with their earnings so that they can achieve some upward mobility. To some degree, those procedural requirements for income documentation, for instance, are difficult ones for earners to meet, and that is what causes some amount of churn.
Oftentimes they can be barriers and they can lead to additional churn, correct? So in the case where somebody picks up an extra overtime shift and works a little bit more, they could be dinged and contribute to the churn rate as well.
That's true. I think what you're describing, though, is this phenomenon of the program operating as it should. So if you take more overtime hours and increase your earnings so that your income exceeds the eligibility threshold for the program, then properly your benefits should be cut off. And if the program is operating as it should.
In my opinion, unless it's seasonal and someone went over by $60, which is something that I did here. So it isn't sustainable in that sense from their income standpoint.
Mm-hmm. Well, it's a good point, and what you're raising, I guess, are what I consider the basic eligibility requirements and rules for the program. Those are clearly ones that should be considered as options before you in trying to address the problem of churn.
Thank you very much. If I could switch gears a little bit, Mr. Ziliak, the 2014 Farm Bill established a new authority by the name of the Healthy Food Financing Initiative, and the goal was, and I quote, to support efforts to provide access to healthy food by establishing an initiative to improve access in underserved areas and to create and preserve quality jobs. Can you explain how this program could affect SNAP participants as well as those who live in food deserts?
It's a great question. The SNAP program, of course, can be redeemed for a whole host of foodstuffs at the grocery store. Many of our low-income families, especially in urban areas, don't have ready access to the whole spectrum of foods that make up the Thrifty Food Plan that underlies the USDA's plan for the SNAP benefit. And so the part of the goal, of course, with this change in legislation was to improve access to a wider array of healthy foods to some of these populations that, we're still in the field with some of these demonstration projects on, do people respond to these incentives to buy additional fruits and vegetables? And there's some of the limited evidence so far that they're showing some effect. And so I think there's a hopeful sign that if you provide access to the food, the people will buy it. And so I think anything that we can do to improve access to nutritive food is a positive step for the program.
Thank you very much. Appreciate it, gentlemen. I'll yield back, Madam Chair.
Chair recognizes Mr. Nagelbauer for 5 minutes.
Well, I thank the Chair and congratulations to her and
Thank you for holding this hearing. I think this is a very positive thing for us to be looking at a program that has been growing, exponentially over the years. And what the statistics now indicate that 1 in 7 Americans are on food stamps. So, for us to analyze what's going on within these folks, and more importantly, hopefully down the road, is trying to figure out a way to make sure that folks have an opportunity to move off of food stamps and to be self-sufficient. Mr. Tordella, in your testimony, you stated that approximately 70% of the SNAP participants who exit the program do so because of substantial increases in income or decreases in the number of families. While these changes make sense from why participants leave the program, I'm curious what your team was able to find out about the 30% of the participants that left SNAP. In other words, you said 70% left for either made more money or the family size decreased. But those other 70 folks that left the SNAP program, what did you learn about them?
Unfortunately, we couldn't really learn anything about them. The way that we analyzed the movements onto and off of SNAP was to take a 4-month window before somebody would go on or a 4-month window after they went off in order to see if certain events occurred so that we could associate those events, but we couldn't pin it down and say, well, that event actually caused one thing or not, cause them to go on to or off of the program.
So how did you survey all of the people? In other words, did you make a contact with that individual? Did you interview them, or?
This is a generic survey that covers a large section of the American population, and it tracks them for a period of 5 years, and actually tracked them from mid-2008 through the end of 2013. So it's trying to achieve many things at once, which is why we don't have a specific set of motivations for moving onto and off of SNAP as you would like to have.
So how do you gather that data on a generic basis?
It's gathered by the Census Bureau on a randomly selected sample, and they go out to these households once every 4 months and ask a set of very detailed questions about their income, occupation, education. This is for every single individual: age, sex, race, program participation, and their labor force participation, all those things all at once, and different types of income. So it's kind of the reprocessing of those data that allows us to infer what happened.
So what would your speculation be that if my income didn't increase and my family size didn't decrease, then, I'm trying to kind of get a feeling here of where those 30% people went.
Where did that other 30% go? Unfortunately, I just don't have any empirical data that would tell me.
All right, I think Mr. Mills has got his hand up.
Yes, thank you. If I could just add, some of those individuals are of the type that I was describing who have procedural difficulties. So there has been no change in their circumstances. Their household composition and income has remained unchanged. But at the time of a recertification, they're unable to meet the procedural requirement to renew their benefits. And so they do go off, many of them for only a short period of time, and then they come back. So that's a form of exit from the program that certainly is in part explaining the 30% you refer to.
And Mr. Mills, you mentioned in your testimony that overall elderly or disabled members are less likely than others to churn in and out of SNAP, and this is due to them being able to wait longer to recertify. However, when specifically focusing on households that churn due to recertification, the opposite is true, that these subpopulations are more likely than others to churn. Can you elaborate on that switch and perhaps why you think this is, how you see the recertification process negatively?
Yes, it's a great question, and it is a somewhat complex story, and it's important to understand because we're all, I think, concerned about food security for the elderly and disabled population. These are individuals who are typically assigned a longer recertification period in the program, typically 24 months rather than the normal 12. So in that sense, they should be less vulnerable to these procedural problems that I described. Because they're within any given year, it's less likely that they will have to renew their benefits. However, if one looks at those who are subject to recertification, are reaching that moment in time where they do have to meet the procedural requirements, individuals with elderly or households with elderly or disabled members are more likely to churn. They're more likely than other households to be unable to meet those requirements. It may be issues of cognitive decline.
I'm sorry, I got to stop you. Mr. Mills, the gentleman's time has expired.
Yes.
Chair recognizes Ms. LaJuan Grisham for 5 minutes.
Thank you, Madam Chair, and I share my congratulations with the chairwoman and the ranking member, as my colleagues have, and delighted to be here. This is a SNAP program, and nutrition programs are very important to me. I spent 17 years in state government as a cabinet secretary for both the Department of Health and Aging, and worked diligently to work on more coordinated benefits between general funded or state funded programs for home delivered meals, federal dollars for that, and the SNAP program, so that it's not just one meal a day and 5 days a week, because we know it creates, it's untenable, it's immoral, and it also creates significant health issues that we pay for, all of us, later, sometimes not that much later. And so, Dr. Ziliak, I know many members have touched on this, but I want to go back to maybe the specifics related to the composition of SNAP beneficiaries and what happens to them. And in your testimony, you said that 47% of SNAP participants who exited the program re-enter within a year, and that families return to SNAP more quickly than individuals without children. And I wanted to hit on one of those. One of those families that you described lives in the district that I represent. Lene Havens is a single mom. She works full-time, doesn't make very much money, and she relies on that small amount of benefit that she receives through SNAP to provide for her son, Connor. Now, Lene described to me that when she picks up extra hours or gets a promotion, then the benefit is taken away, and we talk about that as the cliff effect. And I wanted to really put that in perspective for folks in the hearing. So here's the example. If a parent with one child working 40 hours per week is earning the federal minimum wage of $7.25 an hour, they got a raise, say in my district in Albuquerque, to the Albuquerque minimum wage at $8.50, then she would receive $208 more per month in salary, but she loses $683 in benefits. She sees a reduction in her housing assistance, her SNAP benefits, and loses entirely child care. So these parents are trying to do the right thing. They're accepting these promotions. They're trying to get out of poverty. They're going back to school. They're enrolling in the required training and work programs. They're doing that on their own, even when they're not required. They're seeking better opportunities, and we pull them right back into poverty because they lose the benefits, have to pay far more, or worse yet, they don't have anything, and now we've got an unstable household. So I want to support those parents that are making some progress, and I don't think we ought to be taking these benefits away. Based on your studies, do you have recommendations for us about how we can help these families transition into better financial circumstances without them having to lose everything that we've put together to create that stability?
Perhaps when thinking about this single mother, when she gets the raise, one of the things that was part of the 96 welfare reform bill when moms were leaving the AFDC and then the TANF program, they would at some point in time lose Medicaid, but it was usually offered for a year, transition. So if you want to think about some innovation on SNAP, perhaps that when there is this income increase that makes them ultimately perhaps ineligible, that there could be a transition period, right, where they can maintain that support for some period, 6 months, 12 months into the future so that they don't feel that cliff immediately and so they can gradually, because we do want people to move up the wage scale, right? There's no question about that. And I'm
going to reclaim my time for a moment. That would be consistent with other benefit programs, as you've identified, because the current system does not incentivize. And I want to be careful that I'm not picturing or creating an environment in my discussion that my constituent and others, purposely back off being promoted. It's a hard life being at poverty or just above. I can't believe that anyone wants to be there. And yet we disincentivize them because there's fear. And it may be that we need flexibility and that protection for a year and give folks the sense that we really are trying to help them get that leg up. Because I don't think that they really believe that. It's a very punitive environment. One circumstance changes. If you don't tell us, we will recoup and sue you and you won't be able to do it ever again. You're barred. Or we take everything away from you and you fail.
So it turns out for the research suggests that in terms of, is SNAP, kind of a disincentive to work, and there's overall the program there is not a disincentive for people to work. But there are people who reach a little higher up in that income distribution, right, just before the SNAP benefit is to be eliminated, and the size of their earned income tax credit is being taxed away. Those are some of those individuals, right, who are, just about ready to make it, right, where those benefits are being taken away at a relatively fast rate. So the programs, we do see certainly some evidence of that disincentive for some of that population. Other of the population, if they combine with their earned income tax credit.
Gentleman's time's expired.
Sure.
Chair recognizes Mr. Benishek for 5 minutes.
Thank you, Madam Chairman. I frankly want to associate myself a bit with Ms. Lujan Grisham in that there is a transition problem that I think we need to address. I know there is a transition program that exists now for a period of months, I believe, when this happens, but I'm not as familiar with it as I'd like, but I think this is a common problem. But I do want to address a question that I have about, and I'm not exactly sure how to handle it, but to me it seems like many of you are talking about fewer interactions with the people that were receiving benefits. And the length of, I can't remember who it was that was talking about the 3 hours that it took to a caseworker to do benefits with someone. Well, frankly, I think that if we're going to have a program that helps people get food, then we should be interacting with them on a regular basis and not just give them their benefit for a year and then have them check in once a year to see if there's a benefit. I think there should be like some counseling going along with this, and that we should have a regular interaction and not just, here's your benefit, see you in a year or see you in 6 months. I think that there's got to be more to it than that. And frankly, I didn't hear any of you talk about anything like that. And so those are my comments, but I want to hear a little bit more about the reporting requirements and what exactly happens if somebody has with a simplified monitoring and that, if somebody has an increase in their income, are they supposed to call you, or does the agency call them, or how does that work? Mr. Mills, you seem to be really eager to answer that.
Yes. Typically what occurs is an individual is assigned a certification period, let's say 12 months. At the end of that 12 months, there is a complete review of all eligibility requirements that one needs to meet to remain on the program. At 6 months, however, there's an interim report that households would typically have to provide. If they have a change in their household composition or a change in their income that would alter their eligibility. So it is their requirement, their obligation to provide that information to the...
What happens if they don't do that then? What happens then?
Well, if they don't provide the report at all, then they've failed to meet a procedural requirement and would be removed from the program. If they provide the report but it is inaccurate, they would receive an incorrect benefit. They would continue to be on the program receiving a benefit that could be too high or could be too low for them, and that's what's picked up in these error rates that we were...
Well, I guess I had a little bit of a problem. I think you referred to like filling out a form as a hurdle. I have a problem with that attitude, to tell you the truth, because I have to fill out a form to do my taxes. And I just don't think of it as a hurdle. I think of it as a requirement in order for me to be obeying the law.
Absolutely.
And I just think that the attitude of that it's a hurdle is the wrong attitude, because I don't like filling out forms either, but the law requires me to do it and to change the way we do things so that you minimize the hurdles is contrary to having good oversight to the program, too.
Yes. No, you're really getting at a very important point. I think the point I was trying to make is that it's the information that we want from the client, and what we should try to do in order to accurately provide a benefit to them. And are there ways to obtain that information with less burden upon the client? So, for instance, I mentioned call centers, using centralized agency call centers so individuals don't have to...
I don't understand what you mean by burden on the client.
Oh, well, I mean time and maybe out-of-pocket expense in their having to travel to a local office rather than being able to provide information by phone. Some agencies require a face-to-face interview with a caseworker. Others allow that interview to take place by phone.
How often do you think that we should be interacting with these people that need our help?
Yeah, well, I think the intervals of time are appropriate. I think it's really more the form of the interaction.
6 months or a year then?
Yes.
6 months? Ms. Cunningham, what do you think?
I think I would agree that that seems an appropriate amount of time, given that households need to report changes in their circumstances. If something happens, if they have an increase in their income, if they get a different benefit from another.
I'm sorry, when the chairman starts tapping, that means we have to stop.
Chair recognizes Mr. Molinar for 5 minutes.
Thank you, Madam Chair. Thank you for your testimony today, and I want to share with you a situation that I experienced when I served in state government in Michigan, and it has to do with a lottery winner who won in excess of $1 million and was continuing to use food stamps, was encouraged to do that by our Department of Human Services, saying that was part of the law. I ended up introducing a bill that required notification to our Human Services Division as well as Unemployment Insurance Agency of lottery award winners, and I believe we've closed some kind of a loophole there because it was considered more of an asset than an income. I know there was some language in the Farm Bill that referenced lottery winners and ending Supplemental Nutrition Assistance Program benefits. If a member receives substantial gambling or lottery winnings, and that's determined by USDA, what is substantial, and then states shall establish agreements in this situation, but they can actually continue to receive SNAP benefits once they meet normal income and resource standards. I guess my question is, are all the states different with that regard if there's a categorical eligibility and a state determines that they don't have an asset test? How is that handled state to state? Yes, sir.
Most states do have a limit, and it's not unlimited in the SNAP program. And so there is some state discretion. Right? It's federal law, right, for the resource limits, and then states apply for the waiver for those resource limits. And so,
what is the resource limit?
Federally for the non-elderly, non-disabled, it's $2,000, and it's $3,000 for elderly and disabled. $3,250, I believe, today, and okay. It's been $2,000 since the early 1980s, so that hasn't changed for a long time.
Okay, so I guess my question is, so in that case, when that person had won in excess of $1 million, the department was saying that was acceptable to stay on.
At the time,
that was in the last 5 years.
Right. At the time, the state of Michigan had waived the asset limit. And so there were roughly a half dozen or so states that had waived completely the asset test.
Are there states that have waived that at this time?
Yeah, I think that's right.
How many states?
I could speak to that. There are about 40 states that have broad-based categorical eligibility programs, and only 5 of them currently have some kind of an asset requirement to that.
So
now, that doesn't apply to everybody in the state. There are some income limits there, too. So it's specific groups that the state's chosen to exempt from the asset limit.
So I guess what you're telling me is there are a significant number of states that have waived the asset limit? And so this could be happening in various states?
It could be. States have the options, and Michigan did implement, they're one of the states that did implement an asset.
We changed it, yes.
Yep, and several other states recently have decided to implement an asset limit.
So I guess my question is, you've done a lot of studies on this, on the program, and you're talking about the efficiencies, and some of the wording was, there weren't many error rates, and would you have picked this up in an error rate, or would that just be considered normal policy implementation?
The household would have been considered correctly paid because by the rules that were in place at that time, it was they were regarded as eligible.
So so when you say the program is being run well, that's according to the criteria that would allow a $1 million lottery winner to continue on food stamps.
That's how the quality control reviews are conducted. They take the law, the regulation, and then say what is the correct benefit given those rules.
Seems like that would need to change. Thank you.
Chair recognizes Ms. Hartzler for 5 minutes.
Sure. And I want to also congratulate you and the ranking member. Looking forward to working with you on this very important issue, and thank you for being here today. I thought I'd start off with Mr. Mills. I've worked with senior citizens for quite a while over my life in different ways, and just wondering, can you explain further the pattern of SNAP churn for households with the elderly? One would expect that these households have a low rate of churn given their longer certification periods and stable financial circumstances. But if I understood right, your study finds that they're more likely to churn compared to others facing recertification. So can you expound on that, please?
Yes. My comment in the testimony was with respect to those who reach the point where a required certification must be made in order to renew their benefits. If you look at individuals at that moment in time and you ask which are the ones who are more likely to churn, that is to say more likely to go off the program and then come back, elderly and disabled or households with elderly or disabled members are more likely to lose benefits at that moment but then come back onto the program, suggesting that they were eligible throughout, but simply were unable to meet the procedural requirement. So that's the sense in which elderly or disabled individuals are more vulnerable to churn than other types of SNAP recipients. It's that, and the reasons are not altogether clear. We did conduct focus groups with recipients. Clearly, and here's where we get to issues of forms and documents and visits to the local office that may be required. Those may be difficult for older or disabled individuals to meet those requirements, whether it's their inability to drive or other cognitive decline issues that they are facing. The requirements are difficult for them to meet.
What is the percentage of elderly households that are on SNAP? It's a general population.
I think I defer to
others
on that.
All right.
The percentage, I could give you the percentage of eligible elderly. I'll need to get back to you with that.
That's certainly fine.
May I?
Yes.
So it's 35% of eligible seniors are on the program today. So given that they meet the income and asset limits, all right, only 35% of those who are currently eligible participate.
So you're saying 65% of there are 65% of elderly out there who qualify, but they don't receive the benefits.
That's correct.
What would you attribute that to? Just the barriers of the paperwork?
A lot of it is barriers. Some of it could be mobility issues for them as seniors. Some of it could be that the benefit, the minimum benefit is $16, and so at the end of the day, the benefit might be too low for them, given the cost associated with applying.
Yeah. Or just pride.
Or pride.
But and how did you get that number?
It's from the quality control data. From the SNAP quality, the administrative quality control data.
Okay. Switching gears a little bit and open up to any of you who'd like to answer, how has the income structure for SNAP households evolved? So has there been a change in the household structure over the years, and is that related? Maybe start with Mr. Tordella. You've done your longitudinal study.
I'm sorry. There has been a drop for individuals and families with income. They have, during our study period, they actually had a drop in their average monthly entry rate, which decreased the growth in that size. So the people who have earnings, who do have some earnings, are are leaving the program or accounting for fewer.
Anybody else want to weigh in on that?
Sure. Looking at households with earnings, if you look at the percentage of households who have earnings, that's raised. It's increased slightly in the last decade or so. In 2004, about 29% of SNAP households had someone in the household with a job, and that's gone up to 31% now. So that's a change. We also see that the percentage of the caseload that has poverty and has income under 50% of poverty is slightly increasing, as is the percentage of the caseload that has income over 130% of poverty. So we're seeing both ends.
Thank you very much.
Chair recognizes Mr. Yoho for 5 minutes.
Thank you, Madam Chairman. Congratulations. Since we came in together, I'm impressed with you. And I look forward to listening to you, because I know the concern in this committee is, like we talked about yesterday, there's a certain percentage of people on the nutritional programs that we've seen are working the system. Some are taking advantage of it, and we need to reform it for those people that truly need it. I mean, that's, I think, what everybody on here is for us. We want the best program we can so that people get the best nutrition they can while they need that. And Mrs. Cunningham, I was reading my notes, and I need some help with the math here, since you're from the mathematics part of this. In 2013, I have 44% of the people were less than 18 that were on SNAP, 18 years of age. 9% were over 60 years of age, and 10% were disabled. What accounts for the other 37%? Because that wasn't mentioned. Who are those?
Sorry. The numbers that I gave in my testimony were households with. So if I could just talk about participants, we'll talk about the percentage of participants who are children. That's now 44%. The percentage that are elderly, that's 9%. And the percentage that are non-elderly adults, that's 18 to 60, is 46%. The percentage that are disabled, that includes children and non-elderly adults, is 20%. So
does that add up to 100? I didn't write those down. I'm sorry.
Well, the disabled is it's overlap between children and non-elderly.
All right. Is there a place I can get the breakout of that so I can see 100% who's on this?
Absolutely.
Okay. We'll get that later.
Our characteristics report.
That's great. And then we were talking about the churn rate. And I had in my notes here also that there was a self-reporting, and I think it was Dr. Abrams was talking about this, and Dr. Benechek, about the self-reporting. Do you feel that's something that is adequate, or does there need to be, as Dr. Benechek brought up, somebody working with them? And I bring that up strictly for this. We had a Section 8 house that we rented out to a family. There was about 8 kids in that family. Single mother, she was working. And as she was working, making more money, the benefits she was receiving dropped, in relationship to the amount she had. And, it was a monthly thing that she was checking in on. And in order to wean people off of this, because my next question is I'll come to in a minute, what happens is people start working, and if we're taking money away from them, as they're trying to get out of that hole, they never get out of the hole because we've got a thumb on them. And what I want to hear from you is what you guys think we should do, how to reform that program. So we want people into the program. We don't want them in there. We'd rather have everybody off of it and self-sufficient, but we know that's not going to happen. But the people that get in there, we want them up and out so that they're on their own and they're living a better quality of life. How do we do that in a reform of a program like this? Start with you, Ms. Cunningham. Sorry.
Well, currently there's an earned income deduction. So 20% of a household's earning is deducted from their gross income. So that doesn't count when we're calculating their benefit amount. So I suppose if you wanted to encourage work and to
which I do.
Yes, and ease that drop-off, one possibility would be to look at the percentage of earnings that...
Well, one of the statements statistics I had, 70% of the SNAP households had no income in 2013. Mr. Mills, if you would say, how do we change that program so that we can get people in, up, and out?
Yes. Well, part of getting up and out is combining, I would say, the value of benefits from the program with your earnings so that you can sufficiently make ends meet, save, educate yourself, take advantage of opportunities that enable you.
We say those things, but what are we doing to make sure that happens?
Mm-hmm. Well, I think...
is there a mandatory requirement that you better your lot in life with education or skills that you learn on these programs? Because I saw the average person on them is on there for, once they enter, it's 8 years.
Well, that's of those who are measured at any single point in time, but as I think Mr. Tordella indicated, of those who come in at any given point in time, if you look then a year later, half of those individuals have left.
And I know we're out of time, but I look forward to getting more information so that we can fix these programs. Thank you.
Thank you to all the members of the panel. Definitely appreciate your expertise. Thank you to the members that were here to have a chance to ask questions. And I want to give, the chair wants to give just a brief closing statement, Mr. McGovern and myself. 35 seconds. Mr. McGovern, 35 seconds.
Oh, thank you very much. Thank you very much for being here. I've learned a lot. I want to clear up a few things for the record. Millionaires on SNAP. It's not a problem. We fixed it in the Farm Bill. It's right here. And to be honest with you, if I was a millionaire, I don't know why I want to be on SNAP. So I mean, it's a non-issue. The other thing too, we've learned a lot here today from people here. That one, that there are very few ineligible people on the program. That this is a very officially run program, and that many families lose benefits because of the procedural problems. And to Mr. Benishek's issue about burdens, it is a burden for somebody to go in person to an office that may not be near where they live, and sit there wait sometimes 3 to 4 hours for this process to take place, and if they're working, getting permission to leave their job to be able to do that. So it is a burden. And then the final thing I would say is that Ms. Lujan-Grisham raised the issue of the cliff. There are some things that we are doing to address that, but this is a wider discussion. The SNAP program is a food program. It is not a job training program. It is not a jobs program. And we need to make sure that everybody in this country has access to food. Food ought to be a right. And I think this is a program that works, and I thank the chair for the generous 35 seconds.
I think you went to 40, but it's okay. And I just want to say this. I think what we saw here today is exactly why we need to have this discussion. I think, back to my original question on, are we really meeting the needs of families? Are we doing enough? Are we in touch enough? Are we really moving people from a program to being able to put them in a matter of success? If they fall back, are we there? Do we know that? And I think that is the validity of exactly why we're here. I think I appreciate the discussion on both sides. I appreciate, again, your expertise. And the reason these hearings are so valuable is to be able to hear fact, be able for members to ask questions, and then to have a dialogue at a level that there is a give and take of understanding that our goal is to remove the obstacles and make sure that every child and adult in this country has the opportunity to have a nutritious meal. And with that, I would tell you that members are voting. Under the rules of the committee, the record of today's hearing will remain open for 10 calendar days to receive additional material and supplementary written responses from the witness to any question posed by a member. This hearing of the Committee on Agricultural Nutrition Subcommittee is adjourned. Thank you.